Hello, I'm Dr. Peter Saunders, the Chief Executive of the International Christian Medical and Dental Association. So my aim is just to give you an overview of where we're at with COVID at the moment. So coronavirus, this amazing nanobot which has burst onto the scene and changed all of our lives. This is where the pandemic is at the moment. You can see that every country virtually is affected to a greater or lesser extent. And if we look at the daily cases from the beginning of the year, you can see that worldwide, the cases are at an absolute peak now, over 600,000 a day. And the deaths, which are a more accurate indication of how bad things are, you can see are just passing the 10K per day mark. These are the last 5 days. You can see the last 4 days have been the highest number of deaths worldwide at any stage in the pandemic. Some countries have handled it very well. So New Zealand here with virtually no deaths, none since September. The US, we're on a third spike now. India has gone up to a peak and then down, but there may be another spike coming. And the United Kingdom, we're on the second spike of deaths at the moment. If we look at the European situation more widely, there are countries like France, Italy, and Belgium, which have a pattern very much like Britain, with an initial spike in March, April, and a second spike of deaths now. And then there are other countries which really had nothing at the beginning of the year. Poland, Czech Republic, much fewer in Romania, which are now really seeing a huge resurgence of COVID. If we look at the top 20 countries in the world in terms of deaths, the big four are the US, Brazil, India, and Mexico, and that's where almost half of all the deaths have occurred. The green countries here in the top 28 of them are all European countries, but the real mark of how severe things are is the deaths per million population. And you can see the worst country in the world is Belgium, followed by Peru, but 4 of these 6 are in Europe. So this is largely an Americas and European pandemic that we're seeing. Most infections are mild. In 20%, they're severe or critical. These 20% require hospitalization, 5% critical. Half of those at the beginning of the year were dying. But you can see that the people with the highest death rates are those aged 60 or over. If you're over 80, you've got a 15% chance of dying. Over 70, it's 8%. Over 60, it's 3%. But if you're young, then it's almost certain you're going to have a mild disease from which you'll recover reasonably quickly. People who are particularly vulnerable are those with associated pathologies like cardiovascular disease, diabetes, chronic respiratory disease, especially also diabetes, and only 1% of those with COVID have no associated conditions at all. So the big message is that this is something where old people and people with other medical conditions are particularly susceptible. How contagious is it? This is contagiousness along here. This is measles and chickenpox, very easy to catch. You can see COVID is way, way back here, so much harder to catch than these diseases. How serious is it? Bird flu and Ebola up here, 50% chance or more you'll die with those. And so we have something that's moderately severe and moderately contagious. And we see here, I think, the incredible mercy of God. Imagine if this was a disease that killed children and young people. Imagine if it was something as easy to catch as measles and chickenpox and as dangerous as Ebola and bird flu. But it's dangerous enough. And we see out of all the infectious diseases in the world at the moment, coronavirus is killing more people per day than anything else. Tuberculosis, hepatitis B, and so on. And these figures are from September, so they're a lot worse now. How many people have had it? The best measure is seroprevalence, which is about antibodies in the blood. And you can see the figures here on the Lancet website. In the United Kingdom, the range of 89 different estimates, they range from 0.5% to 15%. So that tells us that the very most 15% of Brits have had it. I suspect the number is actually quite a lot lower than that. And the vast majority of people, even in heavily infected countries, have not yet been exposed to the disease. So we're at the very early stages of this. What about treatments? Well, the thing we know that does work is if you nurse people who are critically ill face down, give them ventilators or other respiratory support, dexamethasone, steroids, very cheap drugs work, and that these three things combined have reduced the mortality rate, the fatality rate, by 30% since April. So far fewer people, just 2/3 the number of people are dying now because of improvements in treatment. What about vaccines? Well, you can see there's well over 100 vaccines being trialed, but the critical thing is how many are at phase 3 here. Only 12 at the moment, but 3 of those have reported in the last couple of weeks. That's Moderna, Sputnik 5 in Russia, and Pfizer and BioNTech. All of these have effectiveness of greater than 90%. This is an absolutely incredible breakthrough, and means that we will now be able to be vaccinating people in the next month or two. And Moderna and BioNTech together say that they can provide about 1.3 billion vaccinations in the next year. So this could be a real game changer going forward, but there's a long way to go yet, and there are lots of unanswered questions with vaccines. The safety issues, how effective they're going to be in protecting people from really severe disease. How long will the immunity last? Will people need to be revaccinated? Will people accept being vaccinated? Lots of big questions. So let's think overall, we have been incredibly effective in slowing the spread of this virus, but we've had 1,376,000 deaths so far in just 9 months, and we're going to get to 2 million deaths by February at this current rate. What impact the vaccines will have, we will just have to wait and see. How does it rank in world history? Well, the worst plagues in world history are listed here with the date, the description, and the number of deaths. And at the moment, this is by February, it's going to be in position number 8, the 8th worst plague we've ever had in world history in terms of the number of people dying. So it is serious. And I think we're in a situation here, rather like Achilles trying to sail his boat between the 6-headed monster Scylla, which is the coronavirus, and the whirlpool Charybdis, not knowing which way to go. Because on the one hand, we have a very, very serious disease which kills vulnerable people very effectively, and which is very difficult to control. On the other hand, we have all the collateral damage effects on the economy and the rest of the population. So massive falls in the stock market, massive increases in unemployment, and most of the countries in the Western world are in quite serious debt at the moment as a consequence of that, and that's having huge knock-on effects. But also the pandemic is dismantling the foundations for protecting and advancing health, and global health has entered a period of rapid reversal. 2 million people a year sounds a lot, but there are 57 million deaths a year, and 70% of those are from non-communicable diseases like heart diseases and strokes, respiratory disease, and so on. And the treatment of all these things is being delayed. So lockdown is leading, particularly in developing countries, to hunger and famine, 70 million being pushed into extreme poverty by the end of the year, worsening mental health, family breakdown, domestic abuse, stigma, and then delays for the chronic diseases and the serious diseases like cancer, diabetes, high blood pressure, heart disease, and so on. So the first spike is the spike of people with coronavirus, but after that there's going to be urgent non-COVID conditions where people are delayed getting into hospital. The third wave is the impact of interrupted care on chronic conditions. And then the fourth wave is the mental health wave, which we are seeing at the moment. These are figures from the US now. 25% of 18 to 24-year-olds have seriously considered suicide during lockdown, and levels of anxiety and depressive disorder have tripled and quadrupled respectively. So this is a disease which is incredibly complex. It requires great expertise from people from different disciplines. We know that measures like social distancing, hand hygiene and masks are incredibly effective in slowing its spread, and that in some countries like New Zealand, Taiwan, Vietnam, Hong Kong and so on, test, trace and isolate has been incredibly effective in stopping its spread pretty much altogether. And this is a great test of government and public policy, some countries have done very badly because they've handled it very, very badly indeed. 3 vaccines now available, more are coming on stream. Treatments have improved since the beginning of the year. Only 2/3 of those with really serious disease now will die than did die at the beginning of the year, but we've still got a big way to go. So there are some of the medical facts. There are also controversies, of course, which we haven't got time to address, but that will give you an overview of where we're at. And we can pick up your questions at the Q&A later in the day. Thanks very much.